Alright, 10 on the right, 10 on the left. 5 on the upper, 5 on the lower. We're going to start with C5. Alright, remember, this is C1, C2. Alright, C1, C2, C3, C4. I will repeat, no? C1, C2. C1, C2 is flexion extension. C1, C2, both together. Okay? This one is C3, lateral flexion. Okay? Shoulder elevation is C4. But we're not going to include it in Asia impairment scale. We're going to start our evaluation from C5. Okay? Please take note. So that's why in the handout that I have provided, I have placed what? A highlight on the 10 myotomes, all right, that we're going to use, all right, for Asia impairment scale. Am I correct? Is that clear, class? So those 10 are okay. Okay, guys, this is different from the regular MMT. All right, because all of our assessment will have to be done in supine. I will repeat, every myotomal assessment has to be done in supine. So you just need to follow the instructions that I'm going to teach you, or the way I will assess it, because all has to be done in supine lying position. Is that clear, class? But we are going to use the same MMT grading. 0 if there's no palpable or visible contraction. 1 if there's palpable or visible contraction. 2 if the patient is able to move the joint, all right, in full ROM with gravity eliminated position. 3 able to complete the ROM in a full ROM, gravity resisted but no resistance. All right. Grade 4, all right. Grade 4, what is grade 4? Moderate resistance. And grade 5, maximal resistance. Is that clear, class? All right. I'll have to start with C5. For C5 class, I'm going to evaluate the elbow flexors. All right. So please take note that you can also evaluate the abductors here. Shoulder abductors. However, in Asia, what is used would be elbow flexors. Please remember that. But if you are doing myotomal assessment secondary to a suspected radiculopathy, you know what is a radiculopathy, right? Nerve root involvement. You can also evaluate your abductors. Remember that dermatome myotome is not only used in SCI, it can also be used in other conditions, particularly in any radiculopathy. Alright? So same dermatome, same myotome will have to be evaluated. However, in SCI, we are only going to use 10 myotomes. Okay, sir, okay, I'm going to test some muscles in your body. All you have to do is just to follow my instruction. I'll have to demonstrate the motion first, and then after that, I will have to, you will have to perform the same motion that I will demonstrate, okay? So this is the first motion, okay, that you have to do. All right, you have to bend your elbow as much as you can. Okay, bend your elbow on your right. Good, all right. Next, on your left, please. All right. So meaning to say, patient is able to do the motion. All right, grade 3 is okay. Then I can proceed with grade 4 and grade 5. All right. So guys, supposedly I should be there, but you won't see me, okay? I will stabilize this one, okay? Kindly bend your elbow. I'll give moderate resistance. Bend. Okay, bend. Okay, good. Next, bend. Okay, further, harder. All right, good. Then I'm going to proceed with grade 5. Okay?
You put how what?
Can or cannot? It's
Can.
fine.
No reduction,
No. Okay. Actually, it's proper that you put towel. But this is not the regular MMT that you do. Okay? Maximal resistance. Alright, good. Next. Bend your elbow. Bend. Alright, good. So that is for your elbow flexors, grade 3 to 5. If the patient is not able to complete the motion, okay, can you bend? Half. Automatic, it's grade 2. Do you understand, guys? Automatic, it's grade 2. Get it? Or, I could actually, to confirm, I could actually place the elbow like this. Okay. Of course, I need to use a bigger, or I will have to like this. Okay, can you bend your elbow as much as you can? Whether the patient completes the ROM or not, that's still grade 2 because the patient can still move the elbow. Correct. If I'm going to test grade 1 and 0, all I have to do is to palpate for the what? Contraction of the biceps. Alright, bend. Alright, if there is visible or palpable contraction, automatic, that is grade 1. No visible or palpable contraction, 0. Very simple, right? Okay, that is for your C5. Next is C6. For C6, I have to place the forearm in a pronated position. Alright, I will have to stabilize the distal forearm like this. Okay, sir, this is the motion that you're going to do. Alright? Okay. Alright, so this is what you should do, sir. Alright, can you do it for me? Alright, good. Okay, can you do it for me? Alright, good. Now, put it on the other side. Alright? Like this. Alright? Alright, good. Now, I'll proceed with grade 4 and grade 5. Okay? Grade 4, move it up. Alright, good. Then, we'll do it on the other side. Alright, move it up. Good. Now, I'll give maximal resistance. Alright, now I'm going to give maximal resistance. Try as hard as you can. Good. Next. Okay. Okay, move your wrist up, your hand up. Try as hard as you can. Good. Alright, that's how I'm going to test. Is that clear, class? Alright. If the patient is not able to do grade 3, alright, let's say for example, patient is only capable of moving it a little bit, then automatic it's grade 2. But to confirm, you can actually place, okay, in a mid position like this. And then ask the patient to, alright, sir, yeah, I want you to move your wrist backwards. Alright, good. On the other side, please. Can you do it? Alright, good. Get it? So 2. But, just like what I said, even if there's only slight movement, alright, the patient is not able to complete grade 3, automatic, that's grade 2. Do you understand what I mean, class? Alright. Then, for grade 0 and grade 1, all I have to do is to palpate the wrist extensors either here or here. This is your mobile wad of 3. So here. Mobile wad of 3 is composed of your brachioradialis, ACRL, ACRB. So they are here. I can palpate these muscles or I can palpate this muscle. The tendons near the wrist. Alright? Okay, can you try attempting to, don't move, huh? Attempt. Alright, good. I can feel the contraction, okay, of the wrist extensors. Alright, can you move it up? Alright, good. Palpable contraction. 1. If none, 0. C6. C7 is elbow extensors, triceps. Alright? I would have to place the patient in this position. Okay? Hold the elbow like this and stabilize it and demonstrate the movement. Sir, I want you to straighten your elbow like this. Alright? Can you do it for me, please? Alright, good. Now, supposedly I should be on the other side. Okay? Can you do it? Alright, good. Next, I will have to give what? Moderate resistance. Okay, straighten up. Alright, good. Next. Supposedly I'm on that side. Okay? Correct. Next. Again, maximal resistance. Okay. But I know that students are lazy, so they will just have to do it on one side. Okay. Alright, you understand, guys? Grade 3, grade 4, grade 5. Get it, guys? Alright. Now.
So must do left, right, cannot finish
yes, yes. You have to do right, left, right, left. You cannot do it. Because you need to take note if there is differences between the muscle power on the right and on the left on a particular segment. Do you understand what I mean? You cannot finish everything in the right and then do again on the left. Because remember class, MMT is relative. Relative to one side. Alright? Guys, can I know if there is difference in the muscle power of my biceps? Okay? If, for example, I have tested, if I don't compare it on the other side immediately, I won't know the difference much, right? Because I didn't compare it immediately. Okay, now moving on. Alright, sir, alright, can you straighten your elbow, please? Alright, okay, patient can only do this. Automatic, it's grade 2. To confirm, I'll place it like this. Alright, sir, can you please try to straighten your elbow? Alright, automatic, it's grade 2. You understand, class? If it is grade 1, alright, I will have to bend the elbow a little bit, like this, okay? And then ask the patient to, or even like this, and then ask the patient to straighten the elbow, or tense the, yes, straighten the elbow, like that. Okay, so I have a meeting by 4 o'clock. Alright, next. So that's grade 1 and grade 0. Now we'll be moving on to C5, C6, C7. C8. Okay. Guys, for C8, we need to place the forearm in a supinated position like this. Alright. Then, alright, I will have to demonstrate. It is for the flexor digitorum profundus, alright, or the finger flexors of the middle finger. Alright. So what I do is, I'm going to stabilize this one, and then I'll ask the patient to, bend your, now I'm going to apply moderate resistance. Alright, moderate resistance. Alright, good. Okay, bend your middle finger. Alright, good. Now, maximal resistance. Alright, move. Further, further, try harder, harder. Okay, good. Alright, bend your middle finger. Okay, that's it. Do you understand, class? That's how you're going to test it for grade 3, 4, and 5. You stabilize the proximal phalanx. The movement should happen between the middle and the DIP, because remember that you are testing the flexor digitorum profundus. Alright, do you understand? And the digitorum profundus is what? Responsible for bending the distal interphalangeal joint, flexing the distal interphalangeal joint. Okay. Superficialis is for the yeah. Do you understand? Guys, this one is not much affected by gravity because these are small muscles. So automatic, if the patient, okay, can you try to bend it? A little bend only. Alright, like that. And this one is not bending, then automatic, it's grade 2. Alright, you understand, class? Alright, can we do it on the other side, please? Try to bend. A little bit. Alright, good. It's only grade 2. Because patient is not able to complete the, flexion of the middle finger. Is that clear, class? Alright. Grade 1 and 0, alright? I will have to palpate for the muscle either here, for the tendon here, or the tendon here. Okay? So it's not going to contract, alright? Going to contract, alright, or I'm going to palpate here. Okay? Can you bend? Alright, or here. Okay, can you bend? Alright, that's it. I'm going to palpate if there is tendon action at the level of the wrist. It's very difficult, class, to identify the tendon of flexor digitorum profundus because from the name itself, profundus, it is located at the deep layer of the forearm. So it's very difficult to palpate it. So that is C8. Now T1, I have to place the, alright, the forearm again into a pronated position, alright, and I'm going to stabilize the arm, okay, like this, alright. Sir, okay, I want you to, okay, move your little finger away from your ring finger. Alright, good, that's grade 3. Again, can you move it away on this side, please? Good. Now I'm going to apply resistance. Alright? So, I'm going to stabilize the arm. Alright, move it away. Alright, moderate resistance. Okay, we'll do it on the other side, please. Okay. Move. Alright. Moderate resistance. Now, maximal resistance. Okay, move it further, further. Good. Okay, next. Okay, move it further. Okay, good. Alright. Guys, if the patient is only capable of doing it a little bit, okay, move it away. A little only. Okay, a little only. Automatic, it's grade 2. Incomplete ROM. Alright, and if the patient doesn't able to move it, you proceed with grade 0 and 1. Okay, all I have to do is to palpate for the hypothenar eminence here. Okay, kindly, should be together. Okay, and then, okay, try to move your little finger away. Okay, oh, there should be no movement. Try to move it away. Guys, I'm only avoiding it now or preventing it from moving. Okay? But supposedly there should be no movement and I will palpate for the abductor digiti minimi. The abductor digiti minimi class is located here at the ulnar border of the hand. Okay, if this is your hypothenar eminence, this is the one located at the most medial location. Remember, this is medial, this is lateral. So the most medial location would be your abductor digiti minimi. Alright, guys, clear? Alright, now moving on for the lower limb, we'll start with L2. For L2, hip flexors. Alright, so all I have to do is to demonstrate first the motion to the patient. Sir, I want you to bend your hip closer to your chest as much as you can, like this. Okay, and same thing on your left. Okay? Can you bring your knee to your chest? Alright, good. Alright, that's enough. Good. Next. Left, please. Good. Alright. Now, I'm going to hold the other one. Alright. Then I'm going to apply resistance. Okay, can you move it up? Moderate resistance. Up further. Alright, good. Next. I'm not going to give resistance here. The resistance is here. Do you understand, class? Okay, again. Move it up. Alright, up, up. Further. Alright, good. Now I'm going to give maximal resistance. Okay, move it up. Try harder, harder, harder. Alright, good. Next, other side please. Move it up, harder. Okay, move it up, further, further, harder. Okay, good. Grade 5. Alright, if the patient is not capable, guys, if the patient cannot do grade 3, do you think you need to proceed to grade 4, grade 5? Not anymore. Automatic, you move to grade 2. Alright. Can you try to move this one up, please? Move it up, closer to you. Alright, automatic, it's grade 2. Do you understand? If not, if I want to confirm, what I do is, I'm going to place it into this position. Okay, can you bend your hip? Okay, okay, so that's still grade 2. Alright, then this one. Okay, can you move it up? Alright, that's it. If you want to confirm only. You understand? So you externally rotate the femur. Alright, and then ask the patient to, alright, to bend the hip. You understand, class? Okay. So that is grade 2. For grade 1, you can palpate either the iliopsoas, but iliopsoas is very difficult to palpate. So you palpate the rectus femoris. Rectus femoris is here. It's on the midline. So here. Alright? So for grade 1 and 0, I'll just palpate for rectus femoris. Okay? Kindly bring your left knee towards your chest. Alright? Good. Then again, your right. Alright? Good. So I can feel that it is contracting. Alright, so grade 1. If there's no palpable or visible contraction, 0. Get it, class? Now let's move on to grade, L3. So for L3, I'll have to place, alright, I'll have to place the knee into this position. Okay? So, sir, this is what you're gonna do. I want you to straighten your knee. Okay, like this. Okay, if not, if there is tightness, I will have to lessen the degree of hip flexion. Alright. So, sir, okay, straighten your knee. Alright, good. Okay. Next. Alright, can you straighten? Alright, good. Next, we'll apply moderate resistance. Alright, move it up. Good. Alright. Oh, I'm opening my hand. I'm not supposed to open my hand. But that's how I usually do my routine. Okay, move it up. Alright, good. Okay, relax. Other side, please. Alright, move it up. Moderate resistance. Good. Oh, it's my habit of opening my hand. I'm not supposed to open my hand. Okay? Again. Up. Up. Maximal resistance. Good. Okay. Maximal resistance. Okay. Up. Alright, good. Understood, class? Alright. Now, if the patient, okay, like this, I ask the patient to, okay, extend, can only do it a little movement, automatic, that's a grade of 2. Alright, this one, alright, a little movement only, automatic, it's a grade of 2. Okay, if I want to confirm, again, I can bend the knee like this, with the hip flexed and abducted, externally rotated. Then I'll ask the patient to straighten the knee. Alright, good. I'll do it on the other side again. Alright, can you straighten the knee, please? Alright, good. I'll give it a grade of 2. So even if in this position, patient is not able to complete, then I do it in this position, able to complete or not, still the muscle grade is 2. For 1, alright, for 1, I will have to place the knee into slight flexion, like this. Okay? I'll palpate for the quadriceps. Okay? And then ask the patient to, okay, straighten the knee. Alright. There is visible and palpable contraction, but there's no joint motion. That is a grade of 1. If none, 0. Understood, class? Huh? Let's do it on the other side. Okay? I'll palpate for the, okay, the quadriceps. Okay, I can palpate the quadriceps, I can palpate the quadriceps tendon. It can also be like that. I will repeat, no. I can palpate the quadriceps muscles, or I can palpate for the quadriceps tendon. Quadriceps tendon, quadriceps muscle. Can also. Okay. So, okay, can you please bend your, straighten your knee? Alright, that's it. L3. Next, L4. Okay. For L4, alright. Sir, I want you to point your foot up like this. Alright, can you do it? Alright, good. Relax. Let's do it on the other side. I'll stabilize the distal leg. Okay, move it up like this again. Okay, can you do it for me? Alright, good. Now, I will have to, what? Apply moderate resistance. Okay, I'll stabilize the distal leg and apply resistance at the dorsum of the foot. I'll give moderate resistance. Okay, point your foot up. Okay, moderate resistance. Alright, good. Now, let's do it on the other side. Alright, move it up. I'll give moderate resistance. Okay, patient is able to do it. Okay, grade of 4. And then, grade of 5, maximal resistance. Harder, harder. Alright, good. And we'll do it on the other side. Okay, harder. Up, 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 harder. Okay, good. You understand, class? If the patient is like this, it's plantar flexed, and then I ask the patient to move it up like this. Okay, point your foot up. Patient is only capable of moving it. Okay, move it up. Okay, automatic, it's grade 2. If I want to confirm, again, like this, okay, then I ask the patient to dorsiflex. You understand, class? Alright. You get it? Same thing on the other side. Alright, dorsiflex, please. Alright, point your foot up. Alright, good. Grade 2. For grade 0 and 1, alright, grade 0, grade 1, grade 0 and grade 1, what I'll do is, I'll palpate for the tibialis anterior. So where is the tibialis anterior? So if this is the tibia. Okay? Guys, this is the tibia. You just move lateral to that. So this is your tibialis anterior. So I'll palpate the tibialis anterior here. I'll palpate for the tibialis anterior here. Okay. Now, what I'm gonna do is, I'm going to, okay, sir, I want you to move your foot like this. Okay? Point your foot up. Alright, good. So that is one. Alright? Can I do it on the other side, please? Alright? Okay. You're moving. Okay, move it up. Alright, that's it. So there is visible or palpable contraction. Alright, grade 1. Otherwise, 0. If there is no visible or palpable contraction. Is that clear, class? Now we'll be moving on to L5. L5, big toe extensors. Extensor hallucis longus. Okay. So, sir, this is what you're gonna do. I want you to move or point your big toe up like this. Alright, can you do it for me? Point it up. Alright, good. Okay? Can I have the other side? So that it's easier. I'm not gonna change.
So this is the last of it. This is the
No,
last
mama.
myotome.
Okay?
Toe extension.
Alright, move it up like this. Alright, can you do it for me? Alright, good. Now I'm going to apply moderate resistance. Okay? So, move it up. Alright, good. Move it up. Alright, good. Maximal resistance. Alright, up. Then maximal resistance. Alright, up. Or I can also hold it like this. But the problem is, sometimes it may not be, okay? It may not be comfortable for the patient. Okay? So that would be for grade, what is that? Grade 4, 3, 4, 5. Grade 2, if the patient is only able to move it a little bit, move it up. Alright, like that. Automatic is grade 2. Again, move it up. Up, further, further. Okay. That's it. Okay. For 1 and 0, all you have to do is to palpate for this tendon here. So, I will palpate. Move it up. Oh, it's moving. Okay? Move it up. Okay. Then, move it up. Alright, that's it.
So what if all the other toes don't move together?
Oh, it's impossible.
Oh, really?
This is the key muscle. This is the key muscle. So if ever this one is affected, the extensor digitorum longus will also be affected. But this is the key muscle that you have to
I
evaluate.
can't do it.
Get it, guys? Alright, next is S1. S1, alright? What I do first is I'm going to dorsiflex the ankle like this. So, from this position, alright, I want you to point your foot down, point up, down, further, further, good. Next, point your foot down, alright, good. Next, I'm going to apply moderate resistance, okay? Either I apply the resistance like this, okay, or I'll apply it like this. So, either like this, or like this. Okay, point your foot down, alright, good. Point your foot down. Good. Give maximal resistance. Point your foot down. Good. Point your foot down. Good. Alright. You understand, guys? That is for grade 3, 4, and 5. For grade 2, okay, from this position, alright, from this position, alright, point your foot down, only a little. Point your foot down, only a little. Grade 2, automatic. Or, I can place it in an externally rotated position like this. Okay, point your foot down. Okay, good. I'll do it on the other side. Alright, point your foot down. Alright, grade 2. Get it? If for 0 and 1, same position. Alright, same position. Alright, what I'll do is, I'll hold this one like this in a dorsiflex position. Because there is a tendency that the effect of gravity will pull it towards plantar flexion. Am I correct? So I might have a wrong impression that the muscle has a grade of 1. When in fact, it's only the gravity pulling the ankle into plantar flexion. So what I'll do is, I'll put it in this position, in a neutral position, and palpate the gastro. Or, more importantly, I will palpate the Achilles tendon. Okay? Point your foot down. Okay? Point your foot down. Alright. So that's how I will confirm whether the patient has a grade of 0 or 1. That's it. Practice.